Welcome to the Reagan Effect. Good morning. This is a conversation about students with disabilities, and it's a place where people can come for education and empowerment on special needs medicine and special education law. My name is Bo Johnson. I'm an attorney practicing in the area of special education law in both Alabama and Washington. And my partner in this conversation is Kristi Krueger, who's a nurse practitioner and who treats children with disabilities. Kristi, I'm really glad that we're starting this. I think it's going to help many people, parents and educators alike. But I wanted to start with the name of our conversation, which is the Reagan Effect, and wanted to ask you who Reagan is and how do you know her and how is she important to you?
Okay, I'm also super excited to start this. Um, Reagan is my daughter. She is going to be 19 in November. She has profound autism and she has been considered nonverbal for most of her life, although she does talk some. And I always tell everybody she's the bossiest nonverbal kid that I've ever met. She has been my inspiration behind opening a clinic for special needs. She's very resilient and she's a fun kid. I have learned a lot through her, and I feel like she has given me a lot to be able to give to others, or I've learned a lot from her to be able to teach others too. So finding you also was a good thing through her. So we're able to start this. So there's been a lot of good outcomes from her.
Awesome, awesome.
Besides the fact she's my kid.
Yeah, well, that's really nice. Can you tell people who are listening about your qualifications and what your experience is treating children with special needs?
Okay, so I have been a nurse since 2004. I have worked all over the place in lots of different states and lots of different areas of nursing, from like high stress ICU crisis nursing to just working in like an urgent care or school. I have had Reagan is almost 19, so I've had a lot of special needs experience through her. Also, I used to, when she was younger, I would go work at the school that she was at, which is usually a special needs classroom or a specific school for her. So I have a lot of experience through that, and then all of the connections that you make when you are a special needs parent. I moved here in 2017 with my family, and it took me forever to find a place for Reagan, to take Reagan to see both of my girls, actually, to get them in with a pediatrician because they have a high patient to provider ratio here to start with. And then on top of that, I was essentially having to apply to get into the offices or fill out application forms or whatever, and then they would send my application around the office and then call me and tell me that nobody would take my kid, or both of my girls, I guess. And I'm assuming part of that was because you had to fill out saying that she has autism, and that's not a super easy thing to deal with. So after being a nurse for like 15 years or whatever, I don't know how many years that was, but I decided I was going to go back to school, and I wanted to be the provider that everybody would, like, if people were saying, where do I take my kid with autism? They'd say Kristi Krueger. She'll be happy to take them. And I feel like I have a lot of experience in that. I did actually work in a clinic for about a year named after my daughter as well, that I had opened with a doctor recently. It just closed. And we have a lot of experience working through that. So I had a lot of my families come there, and they're waiting for me to open again.
Okay, awesome. So your plan is to open another clinic treating children who have autism and other disabilities. Is that right?
Yes, like across the lifespan, though, not just children, so that I'll be able to keep them as they're transitioning into adulthood. They don't have to change providers. They will just have one consistent place that they can go to. And I like doing the primary care model because I feel like it's, instead of going to your regular doctor all the time and then you go see me like once a year or twice a year, it's kind of hard to get all the resources and stuff that they have available and to understand them and to make sure that they're following through with them. If they don't, just hand them a stack of paper and they leave, and then they come back and haven't done anything with the stack of paper because they didn't exactly understand what they were supposed to do. So I am planning to open. I actually am supposed to be signing a lease in the next couple of days and start credentialing for insurance, and I am super excited about that.
Well, that sounds great. I think, the conversations that you and I have had, just in our relationship as attorney-client, we talked about the importance of having of parents who have children with disabilities and of course adults with disabilities, having a provider who understands the nuances of the particular disability, who understands the details of specific treatments, and who will actually listen to a person who has a disability, or if that person, particularly someone like Reagan or other clients I've had whose children are nonverbal, the parents are the persons, giving the history, and sometimes, unfortunately, physicians, nurses, and other, healthcare providers are busy. They're seeing a lot of patients, and sometimes I don't think that they take the parents seriously, when the parents have legitimate complaints, and sometimes they blow them off, or sometimes they discount the seriousness of what the parents are relaying simply because the children can't explain it themselves, right? Have you ever
Right.
experienced that?
I have a lot with that. And
Yeah.
that's one of the things that a lot of my parents talk about when they come in is that I sit down and I listen to the parent because they know them better than anybody else is going to know them, especially with the amount of time they have to spend with them. A lot of our kids are 24/7 supervision. I get a lot of feedback saying that they like that I sit and that I listen to them and that we come up with a plan together. And they also like that while I'm talking to them, I'm sitting there watching their child and
Yeah.
just observing and making observations about them. I understand that even if they're running and jumping and bouncing off the walls, that doesn't mean that they feel fine. It could be the opposite, actually. Like their behavior tells you a lot. That's another thing that I talk to them about too. If they're having brand new behaviors, we always are trying to figure out what new things are happening or what things might be going on. I'm trying to think what else they have. I don't know. You can keep going.
Yeah, well, I think, in starting this conversation, that we're calling the Reagan effect, one of the things that we decided to start with, speaking of listening to your patients, listening to parents, trying to really focus on what's going on, is the importance of communication, not only in the provider patient relationship, but also, as it relates to Reagan's experiences in school, being a student who has an IEP, the level of communication that exists between the parent, the student, the IEP team, and special education administrators. And I think when you and I were trying to figure out topics for what our first conversation was going to be, we shared that many people have related to us that, they don't feel like, some parents don't feel like providers listen, and some parents don't feel like school districts listen, and IEP teams don't listen. And there's many times miscommunication that can really sour a relationship right at the beginning and create these, waves of turmoil down the road that lead to resentment and anger, and ultimately, sometimes some disagreements. And so I think, preparing for this, you and I agreed, hey, let's tackle the topic of communication for our first one and see where that leads. That seemed to be, when you put feelers out there, that seemed to be one of the main
Mm-hmm.
things. And I know that I've shared with you that many of my clients have said, my kids' teachers, my kids' IEP team, they don't communicate with me. They don't tell me what's going on. If they just did more of that, I wouldn't be so frustrated. So I think it would be productive for us to talk about how parents can do that, right? How do you and I, through our experiences, empower parents to get and obtain better communication with the IEP team to ensure that the first of all, IEPs say what parents want, and that the IEP team understands everything about the child that they know, that they need to know to make, decisions for the child to receive a free and appropriate public education. So I thought we would just jump into it. You ready to go?
Sure.
Okay. I think one of the things that I've experienced, in my time as an attorney dealing with parents in school districts, is that oftentimes parents feel that they communicated something to the IEP team, or the IEP team feels it communicated something to the parent, and in many circumstances, neither of those things happened. The parent didn't communicate what he or she intended. The IEP team didn't communicate what it intended, or if there was communication, it was never put into the IEP. So I think one of the a quote that got my attention the other day was that the single biggest problem in communication is the illusion that it has taken place. And I think that's really applicable, to IEPs, and not only that, but in relationships between medical providers and patients, particularly nonverbal children. And so I thought we'd start off by just discussing that maybe communication is the key to any healthy relationship. I think we can both agree on that,
Yes.
especially with your child's IEP team. And I wanted to start us off on this particular topic by emphasizing that when parents are communicating with an IEP team, the IEP team um, has possession most likely of the student's or the child's entire education record. They have access to it. Many parents don't. Many parents have bits and pieces of their child's education records, but they don't have the entire record. And one of the things I try to do as an attorney, anytime I get a call from a parent or a new client uh, who wants to talk to me about a special education issues, is I immediately encourage the parent to obtain his or her child's education records so that the parent understands everything that's in the file and understands what information the IEP team has and the basis for some or all of its decisions, and at the very least to understand what the IEP team is talking about when they're referring to a test result, when they're referring to an evaluation, they're referring to attendance records or disciplinary records that the parents may have never seen, but are in the child's education records. What's your experience with obtaining Reagan's education records and what you found once you got them, as opposed to what information you had in conversations with the IEP team before you had the file?
So and I have been in a lot of different school districts before we moved here in Alabama. Alabama's probably been the hardest to get records from.
Yeah.
A lot of the time in the other schools we were at, I had Reagan at a couple of different private schools, and we always had like all of their records. And I actually up on one of the shelves in here have stacks of her education records from her like 3-year-old on all the way up. I sometimes will get some pushback because I don't feel like all of the staff understands, and maybe I was asking the wrong people in the beginning. Not all the staff understands that we have access to that. We are supposed to have access to that, and they'll talk about HIPAA, which has nothing to do with the school district. It
Right, right.
has to do with insurance and your protected health information. And I'll get pushback from that. But for the most part, if you ask the correct people or ask all of the people so that they can all be on the same page, it's easier to get your records back that way. And I think that's way more helpful than just the little pieces they give you here and there.
Well, I think it's important. I've had conversations with parents where they said, "Well, I've got the disciplinary record about what happened the other day, or I got the attendance records, and or I got the iReady report," and they won't have anything else. One of the things I hear too is that, for example, if a student is supposed to receive speech therapy or occupational therapy at school, the parents believe, well, he or she didn't get that today, or he or she hasn't got that in a month. And what I always say to parents is, look, there's a record of it at school. You need to request the record to find out when exactly your child has had related services therapies. And and I tell parents, for example, that if your child is supposed to receive an hour of speech therapy a week, well, then that speech therapist is supposed to keep a record of that and log that time, log what's covered, explain what therapeutic tasks were performed, and then that goes in your child's education record. And so, one of the things I thought I'd highlight, on this particular subject is that parents can make a request for their child's entire education record going back as far as they want under FERPA, and FERPA is an acronym that stands for the Family Educational Rights and Privacy Act. And under FERPA, parents can obtain a complete copy of their child's confidential education record and take a look what's in it, and take a look and ensure that it contains the things that parents believe the schools should know about their child. And if I always tell parents, if you ask the school district to put something in your child's education file, they'll do it. I've never had a school district say, we're not going to put that in your child's education file, particularly if the parent sends that with a note or an email or a letter that says, I need everyone to know about this thing, right? This particular change in behavior, this change in medication, this change in the outside therapy schedule. School districts will put that in the file if parents ask. And so I advise people to use a very detailed form for requesting that, and we can talk about that at the end. But that's available on my website. People can download it and use it. They can modify it however they want, but I suggest that people start there. I also, Kristi, wanted to ask you about if there's a change in the child's medical condition, such as, the child's symptoms are getting worse, or, for example, if a child has behavioral issues, or psychiatric or psychological disorder, and medication is changing or behaviors are changing. Do you feel that's something as a practitioner that parents ought to notify the school about?
I think that depends on the case. It depends on the medication that they're on too. There's some medications that I will have parents start with if they're having if the child is having behavior issues at school. Sometimes I will have the parents start the medication and see if they get any different reports back from the school prior to telling them that they're on something new. With some of the new medications that are out there, there have been some that they're low risk medications to be on anyway, so it's not something that I'm super worried about the school knowing right away, or maybe just even their speech therapist or somebody that they see on a regular basis, just so we can get some kind of feedback that's more neutral, if that makes sense, that they aren't looking for changes in their behaviors. But I do feel like for the most part, if they're having behavior issues at school and we're changing medicines over and over again, that the school should be aware of that.
Yeah, I agree 100%. I think that, and I've represented parents whose children are on, very strong medication to control ADHD or, oppositional. I mean, no, I'm sorry,
Right.
some other type of disorder, and there's a change in the medication, the dosage level, or the parents find out, my child has not been taking the medication, he or she's been throwing it away or not, or pretending to swallow it and spit it out. And that usually manifests itself when, behaviors suddenly change. And, I don't know as nearly as much as you do about this, but I understand that when there's a change, when a person who's on a particular type of medication stops cold turkey, there can be some pretty significant, changes in behavior that occur, not to mention the health risks that go along with it.
Right.
And so I always encourage parents to say, look, if your child is changing medications, or you've noticed a change in the pattern of dosages, or something else, let the school district know that. And, I also tell parents that, look, you don't have to give the school district your child's entire medical record. You have control over what records they receive, and they can't get those medical records unless you give them permission to do so, right?
Right.
You're limited to what you give them, but I think it is important, um, particularly if the child has a history of behavior issues at school, that you keep the school district informed about, if this child's behavior is getting worse, is it possible that it's because of the medication? What are your thoughts on that?
I'm not exactly sure what question we're asking on that. I feel like the changes in medicine definitely can cause behavior issues. There are medicines that you cannot just stop cold turkey. They do, well, you can stop them cold turkey, but there can be some significant behavior changes with that. I think another problem we run into though in the medical field with these kiddos is that some of them will only eat like 3 different things, and we can't get them to take the medicine no matter what form it's in.
Yeah.
And even some of the patches and stuff, like they can, sensory wise, they can't have it touching their skin, or you have to sneak it on them, but then you got to sneak it off of them because it can only be a certain amount of time. So getting them to take medications in general can be hard, especially in our nonverbal, super sensory, ARFID, don't eat anything foods, and you can't touch them. You can't touch the foods with their
Yeah.
medicines. I think we have a hard time with that.
When you're what is your experience, Kristi, when communicating something like a medication change or change in behavior, or anything that relates to, that related to Reagan or relates to Reagan? Who do you normally communicate with about that?
So I do talk to the school. I usually talk to her teacher and see how she's been doing on the medication while she's been at school. If we are having issues, I will talk to the school about that. Reagan sees a psychiatrist also, and I will follow up with her. We were having some issues at one point, and the psychiatrist just kept telling me it's not the medication, because she wasn't sleeping. We were having a lot of bedwetting going on, and ended up not being the medication, but it was still something. Like, that's where I was communicating, was with her psychiatrist. But definitely with the school is a good place to start with.
Do
to see
you
if they're
have a
having behaviors there.